And I typically use coils, and so for lower GI bleeds, and this one, I don't comment on my coil pack here. This was not that great.
I don't comment on coil packs for these little marginal arteries for lower GI bleeds, because sometimes it'll literally come out like piece of
string,
straight.
Like
super straight. And I'm like, oh man, it's like shit.
Yeah, but then it embolizes.
It's gone.
Yeah,
right.
Yeah,
I bet that thing is completely occlusive.
Oh yeah, I mean. Here's post coiling, and you don't see the extra that we saw before, right?
Would you use like a 2 there?
This one, to be honest, I don't even remember, but I probably got the smallest that we had at the time.
It's like 2 for me.
Yeah, and this is probably even now. This is actually an older case of mine, but now I've been spoiled with detachable coils, and I like them. I like them so much. I know they're so much more expensive, but they're just you get better coil backs.
You know what is more expensive than that is when they have to pay for a foreign body retrieval.
Yeah, exactly, right.
I mean, this nester that's flown somewhere.
I have a feeling this case might be a pushable, and I know it's so much cheaper. My partner's comment on it now too. I love detachable.
I have zero guilt about it. I didn't even.
Good. Makes me feel better.
I don't think I ever used a pushable coil in training. I mean, a detachable coil. I think
yeah. Oh yeah. It was. We would never use it. I didn't even know how to use a detachable.
And they were so good at it. There are negatives. The negative is that you to some degree lose that ability of sizing. It's like I'll try a 3 here. If that doesn't work, I'll reshoot it. There, you had to know. You had to know like what size and what length. But that's like a first world problem. I have no guilt about using detachables.
That makes me feel way better. And so I typically use coils now. Fortunately, I've been experimenting with some other embolics now too, especially because one of my younger partners is a huge liquid embolic guy coming from Sinai.
You call him a gluru?
Ooh, I'm going to use that next time. Gluru. I'm going to text him that after this. Right?
I just made that up. Trademark.
I love it. Oh wow, I'm gonna use it. Glue is pretty awesome. I mean,
I'm learning it right now.
Yeah, and I've been using it now. In this situation, would I use glue? I mean, here's some of the issues, right? So you glue and you glue, you commit, and you rip that microcatheter out. I mean, it's debatable whether like something like this, would I use glue in retrospect? I mean, it's a very great embolic, but it's expensive, and it does have its value in other cases. And in some cases of GI bleeding. I mean, have you seen any case, like I'll tell you of one that I use glue that I'm happy of. How about you first?
Yeah, I've used it in a few. So I used glue in other applications in training, but not in GI bleeds. And a fair amount. I've just been doing glue in GI bleeds for about the last 8 months, and I've used it in upper and lower. My general approach to it for lower is if I can get out there to that small artery supplying it, it's getting a coil. If I can't get out there, so looking at your image, look at the images on the screen, the image on the right. If that is as far out as you could get and you couldn't see the bleed, that little branch that was coming off, that may be somewhere that I would consider using, or a coil won't form. But it's not my primary for a GI bleed, a lower GI bleed, unless it's like an AVM, angiodysplasia. I still prefer coils.
Yeah. So what's the advantage of glue then?
So it can get farther out there. I mean, it works like a liquid, but you can kind of control.
I see. You can get it farther than a coil.
Thickness. Yeah. So like if you can't get out to the little branch you want to, you could infuse it and let it get farther out there, but you have to understand you're taking out a larger territory.
Right.
And depending on the concentration you use, it may get out there pretty distally. But the other thing I say to that is, one of the things I learned from one of the GI docs in my last job in Nashville is if you see the bleed and you embolize it, it's not the worst thing in the world if you cause ischemia there. The worst thing that you could do, aside from taking out the whole SMA, it's like the next step for them a lot of times is a hemicolectomy. It's like, so if you if you cause ischemia of a small segment of colon, we know exactly what segment that is. That makes our resection a whole lot easier because we're not taking out the whole colon.